very good afternoon. And wow, this was just a pump-up afternoon just now, right? Session. And I'm glad because I thought I'm going to be the last speaker and it's going to be difficult to get this through. And okay, so since everyone is ready, okay, I'm the last speaker of the day and I will be talking about breast cancer, how to be breast aware. So before this, I would like to thank Karen and Menopausal for inviting us to share this important information to all the ladies around here. And I think it's just not for us, but it's our for family, our children, our grandparents, and friends and relatives as well. Okay, so I hope you all will gather something from this. Okay, I think breast cancer now is a very, very common cancer everyone knows about. What is breast cancer? I think it's very simple. It is the cells from the breast tissue, when they start to grow in an abnormal and in an uncontrolled manner, then they will form and become a group of uncontrolled growth, and this becomes a cancer. So what happens is in our own body, we all have cancer cells. We all have abnormal cells. All right, there will be wear and tear of the tissue, and there will be abnormal cells. And what happens is the cell will eventually be damaged, but our immune system have a very special immune system whereby we can detect and then kill this cell off. Okay, this is called the cell apoptosis. All right, this is a very natural mechanism of our body. So, but when when our immune system has deteriorated and when we cannot remove the damaged cell, then what happens? The abnormal cells will start to grow and divide, and when they start to divide, they go and continue to grow in an uncontrolled manner, and this is how the cancer is formed. And when they get stronger, right, and they start to invade the tissues, the blood vessels, the lymphatics, and they start to spread to other places of the body. So for breast cancer, they normally spread to the lungs, the liver, the bones, as well as the brain. Okay, so this is what we call as invasive breast cancer. Now, what is the statistics in Malaysia and worldwide? It's the most common cancer in women worldwide, in Malaysia, Asia, and the incidence is increasing. And the age of diagnosis is also, interestingly, getting younger. So if we look at the lifetime risk, out of 15 women in Malaysia, this is the data from 2016, 1 out of 15 women will develop breast cancer in their lifetime, right? Whereas in the developed countries like Australia, US, Europe, 8 out of 8 women, 1 will be diagnosed with breast cancer in their lifetime. Okay, in places like Israel, I think it's 1 in 4. All right, so it's very, very common. Okay. So if we look at the age of onset now, this is very interesting because when we look at the developed countries, usually we know that as the age increases, the chances of getting cancer or any cancer for that matter is higher, right? But in Malaysia, in Asia, so in developed countries, 80% of the breast cancer are usually postmenopausal. So that's why they always talk about, more than 50 years old, you must go for your screening, and because the chances of getting cancer is higher then. But what happened is in Malaysia and Singapore and in Asia, now more than 50% of breast cancer patients are actually more than 50 years. As we get older, it is actually less, right? So we see a higher incidence in the younger age group. Right. So, common question, what causes breast cancer? Now, body cancer nowadays is pretty unknown, right? Last time we used to think if you smoke, you get lung cancer. If you drink alcohol, you get liver cancer. If you take the betel nut, you get esophageal cancer. Now, even young people, no smoking, they also still may get lung cancer. All right. So for breast cancer, we do not have a specific known cause, and hormone replacement therapy does not cause breast cancer. All right. And okay, so but what we have is risk factors. That means who are at a higher risk. So if you are a female, you are already at risk. Okay, and of course, increasing age, right? 2/3 more than 50 years old will be chances, and this is in the developed country. And in Malaysia and also in Asia countries, I know throughout we can get breast cancer. And women with dense breasts now. Women in cancer, there's a higher chance of getting breast cancer, detecting cancer late because the breast is firmer, so it's difficult to detect small cancers compared to a softer, fatty breast that is mostly seen in Caucasian women. All right. So Asians, we tend to have dense breasts, that's why it's difficult. to detect. Those with genetic history like BRCA gene or family history of breast cancer, that means it's more than 2 or 3 in the family, like first or second degree relatives. If you have previous history of breast cancer, early puberty, late menopause. Now, these are the factors that's not in control. That means we cannot do anything to avoid this, right? Some of the factors that are in control, but they are not very high risk. And what are they? They are like obesity, lack of exercise, alcohol, smoking, and increase in estrogen exposure. All right. So, but again, this is very, very 1 to 2% risk only. Okay. So what are the presentation of breast cancer? Normally, it is a painless lump. All right. You have a lump that is painless. That could be painless. And in early cancer, the breast cancer lump is not painful. All right. So we have patients who have a lump that is the size of an orange. And they say, oh, it's not painful, I'm doing my usual thing, I'm not losing weight, I'm eating well, I'm exercising. You know, they didn't expect it to be cancer, all right? So it is a painless lump. So important is that we need to look for any recent unusual breast changes that can present as possible cancer, all right? So what are the unusual changes? It will be things like a nipple discharge, unusual nipple discharge like it's bloody or clear fluid, or it could be like, you know, a skin that is rough, or atypical fullness, right? There's a retraction of the nipple, any unusual changes that is very recent, okay? Then you have to get it examined, right? So it is very sad that these days it is common that we see still delayed and late presentation. So we have a lot of patients that's coming in with even the ulcerative lesion. They keep this lumps and this tumor until it is fungating, it's ulcerating, or it is so big they cannot hide it from the family and it's so painful, then they only present to us, or if it's bleeding, right? So we still see this very common. So even this, and these are not like, you know, in a kampong or the ulu places. This is in Penang, and these are our cases in Penang, where we can, in every few meters, we can have a hospital, a clinic, right, to get it examined and investigated. Our patients still come at this stage, all right? So I just want to, okay, so what are the other signs, right? Like indentation, like sometimes there's nipple rash, or there's a nipple rash, or there is unusual lump that is developed that is hard, or sometimes there's abnormality vein, or sometimes like a coarse skin, all right? We call it podorange, like a very rough orange skin, okay? So these are all the some recent changes that if you notice that it's not normal, that has developed recently, then this is where you come and get investigated, all right? So bear in mind, you don't wait for a pain to develop, okay? Because breast cancer lumps are painless. Right, so when you have been diagnosed a breast lump, do not be scared, because not all breast lumps are cancerous. 80 of the breast lumps are often non-cancerous, okay? And what are they? They can be a fibroadenoma, a cyst, abscess, or sometimes a fibrocystic disease. Only 20% of the cancers that are diagnosed are cancerous. Okay, so if we look at the incidence of age, right, if you are diagnosed lumps in the younger age group between 20 to 30 years old, then it's usually a fibroadenoma. These are all benign cases. And if it's between 30 to 50 years old, which is during the perimenopausal age group, then you get fibrocystic or breast cysts, which is very common. And of course, if cancer can be diagnosed at any age, but of course the incidence is always higher when you get older. Right. So one of the common presentation that I see in my clinic is always breast pain, because patients always think that, oh, I've got a pain, then I'm worried that it will be a cancer. Yeah. So they will come, but only 70% of the women worldwide will present with breast pain. So this is a very common, normal presentation in all of us as a woman. All right, and this is also largely due to our perimenopausal changes, hormonal imbalance or fluctuations that causes this pain, this development of cysts. All right, this is something that you cannot avoid. All women will, 70% of the women will have it, and we don't have any medications to, just get rid of it. All right. All right. So the cause of the breast pain can be cyclical because of hormonal changes, like during your period when you're younger, or sometimes it can be, or it can be also happen at any time. All right. Or it can be non-cyclical causes, like maybe a muscle pain, a muscle pull, right, and a costochondritis. And usually this development, if there's any cyst or any abnormality, usually it is benign. All right? And how does the pain present? It can be a twitching pain, it can be a very dull pain, it can be tenderness, throbbing, sharp stabbing pain, it can be one side, two sides, or it can be, you know, anytime, anywhere. All right? So last time I was thinking only during period I have the pain, but it can happen before period, during period, and even after menses. Right? Cancer can affect anyone, all right? So don't think that, you know, I'm fit and healthy, I eat healthily, I, you know, go for my exercise, I play tennis every week, I won't be able to get cancer. It doesn't happen to me. I don't have family history of cancer. I do not have this. It is impossible, right? It can, as long as you're human, as long as you're a woman, then your chances of having cancer is higher, right? Even in males, although it is not common, in female, 1 in 15 women will be diagnosed with breast cancer, but in men, it's about 1 in 70,000. So if you have any unusual lump, you think it's just a mosquito bite, all right, and it has not healed, then please have it investigated. Even women who are pregnant, who are breastfeeding, who have no family history of breast cancer, they can get it. Even the very young, right? The youngest that we have been reported is as young as 6 years old. Okay, this is a young girl from Kelantan. Mother noticed when she had it at 4 years old, a small 2-centimeter lump, didn't think much about it because, you know, it was not painful, she was well, and then that lump grew, and when she took them to the hospital, and, you know, surprise, was diagnosed to be a cancer. Okay, so how do we examine our breast? How do we be breast aware so that we know, you know, how to detect any cancer, right? Or any lumps, sorry. Right? So we need to familiarize our breasts with regular breast self-examination. So now how many of you do your own regular breast self-examination? All right? So it's very important. You'll be surprised, a lot of people, they come to me to clinic and they say, you know, I don't examine my breast. I come here once a year for you to examine my breast. I don't touch my breast. All right? So this is something that you can do to help yourself. So you must, all right? You don't have to, you can do it privately, naturally, right? When you're lying down, when you're sleeping, when you're showering, right? This is how, so I will be, and how do you examine your breast? So when you start examining your breast, you do it, last time you used to say as early as 20 years old, but now I would say that at any age, even if for young children, when they reach puberty, you please teach your daughter, your grandchildren, how to examine their breasts, how to know their own body, all right? And don't just rely on the doctor or the nurses or the parents to do all these things for you, okay? So, all right, so I'll be showing you how to examine your breast. Can you hold this for me? Okay, so basically, can you all hear me? Yeah, all right, so you use 3 fingers, the palm of your 3 fingers, all right, and then you will examine your breast by gently massaging your breast. So basically how you do it is like giving your breast a massage, all right? Okay, it's not, just touching the skin only. You have to really press down until the bone area, if you can, if it's comfortable, okay, to feel, right? So every month you do this, and then you know. Okay, wait, let me just. All right, so don't do this because sometimes our breast is actually tender, and some of our breast is firm, all right, and it's dense. That means it feels like very hard, very firm, okay? So don't do that. This is how some people will actually do that. I have a lump, you know, I say, show me where's your lump, and they just press the whole thing. This whole thing is the lump. I say, no, this is actually your whole breast, all right? Because some Asians tend to have very dense breasts, and that's why it feels like a whole lump, but this is not the way how you examine your breast, okay? So you press down in a circular motion all over from the top to the bottom, from the sternal area until the edge, and even your armpit. So you have to do that every, if you are menstruating, then you do it 1 week to 10 days after your last day of menses. And if you are postmenopausal, then you do it every month, okay? You don't have to do it like on the 1st of every month. Actually, you can do it anytime, any day, anywhere, all right? Okay, and so there are a lot of information on the web to show. And why is the importance of, you can do it while taking shower, and then you look at your own breast, whether the nipples are equal or there's some abnormalities or inequality of the shape and the sizes, okay? And also sometimes you can press your nipple and see whether there's any unusual blood discharge. Now, the importance of doing breast examination is, how to detect. If you start examining, it may be a bit difficult to find, like if there's a lump, if you're not familiar with it, all right? So by accident, if you examine, then it will be about 2 to 3 centimeters in size, all right? But if you do regular examination, you can detect as small as 1 centimeter lump, all right? You will know, sometimes, how come I just felt this lump? It's just like when you're sleeping on your pillow every day, you know how your pillow feels like, right? Then if your daughter or your child put in a ping pong ball, then you know, hey, there's something that's not right, okay? So this is how you feel. And, all right, so when you have been diagnosed with a breast lump, and you please go and see a doctor, and then what should you'll be investigated. They will do a clinical breast examination. Then nowadays it is important that the doctor will send you for an ultrasound, breast ultrasound, as well as a mammogram, and if necessary, then you will do a biopsy. Now, those days, 20, 30 years ago, we will have the doctors who just feel and say, this is a very mobile lump, so it doesn't matter, I don't think it's cancer. All right? Yes, we can do that 20, 30 years ago, but nowadays we cannot assume such. Even a very mobile lump that feels benign can very well be cancerous. So, so you should know that you should have a mammogram as well as an ultrasound. So what is a mammogram? It is a low-dose X-ray of the whole breast, and this helps us to detect very early cancers even before they are felt. And 20%, and these are called the calcifications. Now, it is normal for us. Calcifications are actually quite common in women, and they increases with age. Right? This is like, sometimes our tissues through wear and tear, and they will be calcified and it will be hardened. So this is normal. Right, so 80% of the calcifications, again, is not cancerous, but 20% can be normal. And these are what we call as microcalcifications. All right, so now don't get carried away by when you see your mammogram report, calcifications, I've got cancer. No, please let the radiologist report it for you and tell you, because most of the calcifications, there are certain patterns of calcifications that are likely to be benign, and it's only certain calcifications are abnormal, right? So if it's a benign calcifications, usually they are large, we call it macro calcifications, and if it's a malignant, then they are like very fine powder that are grouped together, we call it clustered microcalcifications. Now, the importance of some of these cancerous calcifications is because they are usually, if they are diagnosed, they are usually a DCIS. So DCIS is ductal cancer in situ, whereby the cancers are still very small, right? Not palpable and not seen on the ultrasound, but eventually, maybe after 5 years or so, they can become a cancerous lump. So you are actually detecting 5 years ahead of cancer if it is an abnormality, all right? Okay, so just now I spoke about dense breasts in Asian women. So Asian women have 70% of the Asian women have very dense breasts. That means they are very firm and sometimes lumpy and hard breasts. All right, so everybody's breast is different. Compared to Caucasian, they tend to have more fatty breasts. Okay, so that's why we always say that the Caucasians, they tend to have more saggy breasts because they are mostly fat, and whereas in Asians, they are mostly dense. That means they are all still firm. So when they are firm, on the normal mammogram, they look all white. Right? So if you have a cancer, when we do a mammogram, there's a cancer, then the cancer also will look white, like that. So if it can be very difficult to detect this cancer in a very dense breast. So that's why for Asian women, I always say that, besides just doing a mammogram, you must do an ultrasound. All right? So this is an ultrasound. That must always supplement with an ultrasound. And so on the ultrasound, we can look at even very tiny cancers like 5 millimeter and pick it up, right? So and again, how do we know? If the lumps on the ultrasound, if it's oval shaped and now nice, rounded and oval, then we know likely it's benign. But if it's irregular, spiky and spiculated, then it is likely to be abnormal. Okay, so this is how we look to differentiate with it, whether it's cancerous or not cancerous. Okay, so we will know. So please, if you cannot remember anything, please remember to do a mammogram and an ultrasound. All right. So I know we do a lot of this wellness checkup in all the hospitals, and more often than not, they only offer you one, which is a mammogram, or you choose one, mammogram or ultrasound. So now I'm making you aware what are the difference between a mammogram and ultrasound, so you make a better choice. Because sometimes the package says you can only choose one, you choose a mammogram. But if you see a dense breast, then pay a little bit more money to go and add in an ultrasound. Alright, because that will assure you that you do not have nothing as abnormal. Alright, so I have a patient who had, this is an interesting story, a lady who had, a young lady, 40-something, very dense breast. 3 years ago, she felt something that's abnormal. She's just a gut feeling. She says it feels different. And she went for a mammogram. And mammogram, oh, it's okay, there's nothing there, right? And it was reported as benign because they didn't see anything because it's all white. Then they, okay, send her off. Next year, she went again for a mammogram because, you know, she didn't feel, she feels it is slightly getting unusual compared to the other side. Second year, again went for mammogram, again it's normal. Third year, again she went for a mammogram, and again it is reported normal. Then only she sick, because at that time it's a bit more obvious that it's definitely more lumpy, but the doctors kept on saying, hey, it's okay, it's normal, all right? And she just finished breastfeeding or something like that, and she just had a child, you know, and they say, oh, it's probably related to your breastfeeding milk and whatnot. Then they say, but she felt something is not right, so that's why she presented to us. And when I saw her, I didn't bother with a mammogram. I straight away put an ultrasound. I did an ultrasound for her, and there was a 3-centimeter tumor. All right. So this is still happening. It's still happening because people are unaware. All right. Okay. Okay. So now, you know, what are the breast screening recommendations? Do we all always go and do mammogram and ultrasound? It is not really necessary. So if you are above 40. Right. If you're above 40, then you do a mammogram, and I will advise you to supplement with a breast ultrasound, and especially so if you have dense breasts. Okay. And if you don't have dense breasts, it's all fatty breasts, and they can see very clearly, then I think it's good enough. All right. But if you have dense breasts, which most females are, then please get a mammogram as well as an ultrasound. If you're less than 40. Or if they say that the mammogram is not well seen and they are not able to comment, then you do a ultrasound if you're younger. And if you're high risk group, then usually we'll add on a breast MRI. Okay. So again, which is better, a mammogram or ultrasound? Now I hope you all understand what's the difference between a mammogram and ultrasound. Again, don't be afraid of doing a mammogram because of the radiation. All right. Now sitting here with so many phones and iPads, there are more radiation going around. All right. And if you travel here and there, this is just one click, and the radiation is just at 1-2 seconds. Okay. And it's good enough to save your life. So don't be worried about the radiation from a mammogram. And if you do not have any calcifications, and generally it's okay, then it's all right to do a biannual mammogram, and then by yearly ultrasound. So this is what I will personally recommend. Okay. Now, blood tests cannot detect breast cancer. All right. So again, wellness checkup. We have all tumor markers being done for you, and then it's like it's normal, right? And a lady also had a lump. She was very worried, but she did not go and seek treatment or being investigated because she was feared that it could be cancer. So she started to take a blood test every month, the breast cancer blood test every month. It is all the time normal, all right. By the time she came and then she did get it investigated, it's already at stage 3. So even up to stage 3 and stage 4, the breast cancer marker can be normal. Right. So when you have a lump, what is the best way to diagnose? Right. So traditionally, people will say, oh, go and do a surgery. There are some doctors still offering that, but I will advise you not to. Please do a core needle biopsy. So a needle biopsy is very safe. And okay. So a needle biopsy is very safe, and all we do is just a 5 minutes procedure, and it is good enough for us to diagnose the cancer and also what type of breast cancer. All right. So don't have this fear that if I put the needle in, it's going to cause the cancer to spread. This is the general. And I asked the patient, who told you that? Oh, everyone else, even the market people also tell me. Right. So please be more informed that it is very safe. All right. If you don't do a biopsy, if there's a cancer, because it's painless, it would have spread already. Okay. Okay, so by doing the biopsy, we can diagnose all the different types, the CIS. Invasive ductal cancer is one of the most common cancer. Lobular cancer, inflammatory Paget's disease, as well as breast. So these are the different types of cancer arising from different parts of the breast. Okay, so next thing you have to remember, when you have anyone have breast cancer, or you heard of anyone having breast cancer, right? Nowadays, breast cancer is just not breast cancer. We want to know what is the type of breast cancer, right? So, okay, so we have 3 types: hormone positive breast cancer, HER2, and triple negative breast cancer, right? And different types of cancer will have different prognosis. Hormone positive is the most common type of breast cancer, and hormone positive is slow growing, better behave, better survival rate compared to the other 2, which is HER2 and triple negative breast cancer. All right, these are less, about 22 and 15%. Now, so coming to this, why we need to know the different types of breast cancer? Because nowadays breast cancer treatment has changed significantly. All right, it has now become personalized. So what do I mean by personalized breast cancer? That means cancer treatment previously 20, 30 years ago was a treatment that is one size fits all. That means you have a cancer, you do a surgery, then you are given the same chemotherapy and the same hormonal therapy. But then after that we realized, hey, how come there are 20, 30% or 50% of them do not heal well, they had recurrence, they come back very quickly. Then we realized through the molecular studies we have different types of breast cancer. So now breast cancer treatment is tailor-fitted, okay? We tailor-fit the treatment because every cancer in each individual of us is very different and very unique. So it's important to know that now cancer treatment is very personalized, because we need to understand. By understanding your cancer type, then we have proper discussion with not just one doctor, we have several doctors. We speak to the pathologist, the radiologist, the oncologist, right? And in order to decide and choose the best treatment plan for you. So some people will ask me, hey, how come my friend, they do surgery first, then after that only take hormonal treatment only, whereas I have to go chemo, then radio, then after that surgery, so they are very confused. They say, I want that type of treatment where I just take medication. I do surgery and take medication. But your type is different from the other person, okay? So try not to compare. Then you get very confused and feel that, you're not being given the thing that you wanted. So again, treatment is precision medicine because they are designed according to the specific cancer that you are using, and on top of that, by doing this personalized, we can actually monitor and adjust. So what do we mean by that? It means that, when we are giving you a treatment, halfway through we realize that it's not responding, or the tumor may have changed, then this is where we start to change the medication for you, to improve the medication for you. Alright? It's just that, you go and tailor a suit, and then, that time you were thin, then after that you went to try it out again, then you put on a little bit weight. No, the tailor have to adjust for you for your big day. Alright, so just as a summarize, what in terms of breast cancer treatment, what do? We diagnose by core biopsy. That's why it's very important. Don't do an open surgery first, do a core needle biopsy first, because from here we can get the results, whether what type of cancer, whether is it early stage, we'll do the staging for you, and then the characteristics, whether is it what grade, is it genetic, what is the genomic. Then we had a MDT discussion with several doctors. Then only we decide whether you do a surgery first or we do a neoadjuvant. So sometimes, a lot of time, 50% of the cancer treatment now, breast cancer treatment now go for chemotherapy. So we do chemotherapy first, and then only we decide on the surgery and the radiation. Alright, so it is so much different from 20, 30 years ago where everyone goes for surgery first. Okay, so what are the treatment options? We have the surgery, and then there's chemotherapy, hormonal therapy, radiation therapy, targeted therapy, and now we have immunotherapy. Okay, so we have progressed so much, and cancer treatment has significantly improved in order to improve our survival rate. Okay, so breast surgery choices. Now we talk about breast surgery. Breast surgery choices, there are several. There is the mastectomy. Right? Unfortunately, 60 to 70% of our patients still present in stage 2, stage 3 breast cancer. So that's why they have to be offered a mastectomy. There's also a breast conserving surgery that means we just remove the lump, and also oncoplastic surgery. Right? So what is breast conserving surgery? That means if you are detected, that's why we create this awareness so that you come for screening, you detect small cancers, early cancers, and then if it's small and early and not so aggressive type, then we can offer you a lumpectomy. That means you just remove the lump, the breast cancer lump, and we conserve your breast. We do not need to remove your breast. And if you were to do that, then you have to proceed with external beam radiotherapy for 4 to 6 weeks. And this is important. You cannot just remove the lump and run away. All right, you have to proceed with a radiotherapy because this will reduce the chance of cancer recurrence by about 60 to 70%. All right. So nowadays we have now the earlier radiotherapy we have to do about 4 to 6 weeks. That means every day you do the radiation for 5 minutes for about maybe about 20 to 25 sessions. But nowadays we have what we call as the latest intraoperative radiotherapy. That means when we do the surgery to remove the lump, at the same time during the surgery in the operating theatre, we will give you the radiation. So this is called the intraoperative radiotherapy. All right. So again, another precision delivery of the radiation dose to the specific site of the tumor, and this helps to reduce the shorter time and also to reduce the dose to the other structures. Okay, so the external beam radiotherapy, as I told you, it is a radiation from the outside to your breast. Okay, so it can cause skin changes like rash, so usually I just say it's a bad sunburn to the skin, right? Whereas the intraoperative radiotherapy, we specifically, precisely radiate the inside of the cavity where the cancer usually recurs, right? And it is by doing the intraoperative, there's a direct delivery rather than the external beam where we radiate the whole breast and causes discomfort and skin changes. All right, IORT is a single dose, and whereas external beam radiotherapy can be about 3 to 2 weeks, 15 to 20 daily dose, right? And okay, so basically the IORT is not for everyone, it's only for specific cases, and certain criteria will only be offered this single dose therapy, which is hormone positive, node negative, older age group, smaller size tumor. All right. Okay, so a little bit about breast. Of course, there are those breast reconstructive or oncoplastic surgery. This is where now at the same time we also, if you have to remove your breast, this is a mastectomy, we can actually reconstruct the breast for you, all right, at the same time, right? So you go in removing your breast and you wake up, there will be another new breast, okay? Versus earlier where we have to remove, then you come back 2, 3 years later, and then only we do a reconstruction. Okay, so how can we reconstruct? We can insert an implant, all right, or we can actually take the tissue or the muscle from your back of the muscle, and then pull it forward to your breast. And also doing a tram flap, which is removing your extra tissue, right? So if you're postmenopausal and we have a lot of extra tires here, and it will be a 2-in-1 surgery, so we take what is here and flap it up there, all right? And we get a lot of good results, and the patients are absolutely happy. Right. Okay, so these are some cases of ours that, a lady, she'll keep her breast lump tumor until so big, then only she came like that walking, because she was trying to hide, and obviously when she can't hide, that's why her family members found out and then brought her to the hospital, and she was scared. And why did she come so late? Her reason was because she was scared that she's going to have to remove her breast. Okay, so if she knew that we have reconstructive surgery, and I'm sure then she would have come earlier. And luckily for her anyway, we did a core biopsy. It turns out to be a phylloides tumor, which is borderline malignant, and she just had to remove it. But because of such a big tumor, we have to do the skin flap surgery for her. Yeah, at the end, I asked her, do you want to reconstruct? She said, no, thank you. She said she wished that she came much, much earlier. All right. Okay, oncoplastic surgery. So we can also do some oncoplastic surgery. That means it doesn't have to be just breast cancer, right? We have unusual cases like this. Is a 15-year-old girl who presented with a very 3 months history of rapidly growing breast mass. So when she went to several that time I think she was in somewhere in Kedah, went to the general hospital or the other hospitals as well, and they told her that, you know, she's young, such a big tumor, you have to remove your breast. If you're the mother, how can you accept that, right? So she seek treatment all the way up to Penang, came to us, and we weren't sure whether is it cancer or not, right? So what did we do for her? We did a core biopsy, right? Remember, a core biopsy, we can precisely target the tumor. And it turned out to be a very rare, benign kind of cancer. It is not cancerous, it's a benign tumor. So within like weeks, well, 1 week to 1 week where we were investigating her before deciding surgery, we can see the tumor growing like 2 to 3 centimeters. Right? It's scary. And anyway, since we knew it was benign, then we said, okay, we can save your breast for you. And so what we did is an oncoplastic surgery. Her nipple is actually very big, like the size of a plate. And a small dessert plate, yeah. And so we removed the lump for her. Yeah, and it is the size, almost the size of a long ruler. All right, and after that, you know, we can reconstruct her breast back her original and reduce her nipple size for her, and it looks almost like normal. Her mother is so happy and so grateful. Yeah. So you see, knowing all these things, we can offer the patient better choices, and this is what we want you to be aware. Okay, so having said all that, you know, reconstruction, oncoplastic surgery. If you need to, you know, we can always do a postmortem, and we can also be braless. I mean, we can, you know, if you have a mastectomy, if you have a mastectomy, do not worry about not having a breast. We can, if you don't want to do a reconstructive surgery, we can offer you. There will be bra and bra prosthesis that will help you to go through this as well. Right. So at the end of all these things, you know, breast cancer treatment is breast cancer treatment patients are surviving. All right, patients are surviving. So this is a breast cancer support group that we have. This is Gun Ho. This is called the breast cancer support group. It's called Penang Breast Cancer Support Group, and we have it in our hospital. And this is Auntie Gun Ho. She's about 71 years old. She's a stage 4 cancer survivor, 2 different primary cancers, okay, and she's a survivor for about almost 25 years plus. All right, so she couldn't come today, but today we have some survival groups here, yeah, and you know, they're part of this group, so let's give them an applause, you know, for being right. And so life after treatment can be sometimes, you know, very emotional, all right? So there are many areas, many aspects of survivorship, life after treatment, like physical, emotional, social support, resources, as well as surveillance, yeah? So that's why we have this cancer group to support one another, which is very important. So, breast cancer, we can survive, okay, depending on, you know, the stages, right? So if you come in early stage, that's why we want to have early detection. So if you come in early stages like, you know, 0, stage 1, stage 2, which we can easily detect through all the screening programs, your survival rate is actually very good, right? Of course, if you come stage 3 and stage 4, because of current better treatment like targeted therapy and immunotherapy, patients are surviving. So I have stage 4 patients who has gone to the liver mets, and I think 16 years on, or almost now 18 years on, she's still surviving. All right, so do not be afraid. Stage 4 days, si liao, but no, it's not. Patients are doing pretty well because of our advancements in treatment. All right, so at the end of all this, you know, being aware, early detection is very important because of, you know, it will give us less invasive treatment, less side effects, higher survival rates, reduce in disease progressions, and also empowerment through knowledge. Yeah. Okay, so some of the things, just to let you know about advancement of breast cancers, review what was before. So before, right, we diagnosed through surgical surgery, which is a lumpectomy, but now we can easily do with a core needle biopsy, which is just a 5 minutes office procedure. Right, we had total mastectomy, but nowadays we can downgrade and downstage your tumor to offer you a breast conserving surgery or as well as a breast reconstruction, so you do not have to remove your breast. Even for axillary surgery, we can do a sentinel lymph node biopsy. We can even do all this genomic testing in order to see whether you can avoid chemotherapy. Last time, if you're node positive, everybody must go for chemotherapy. Now, through all these new tests, we can see whether you can avoid chemotherapy, right? And also BRCA gene tests. You know, before, people are not aware of such things, but because we can do these tests, we can know how to treat you better. Radiotherapy, we can reduce the percentage of radiotherapy from 25 sessions to, if can offer you a single dose, is even better. And also, neoadjuvant chemotherapy helps to improve your survival rate and reduce your local recurrence rate. Okay, so I think Dr. Dicky and have touched on this about lifestyle medicine. At the end of all these patients were asked, how can we improve our lifestyle and improve our life? Yeah, we can do that. 6 pillars of lifestyle intervention, I think we are stressing again and again, right? Nutrition is very important. Have healthy, fresh, natural food source over processed food. Okay, have 5 different colors. You must have some amount of protein as well. So you make a choice whether you want a meat protein or plant protein. Protein is very important. The problem is after 50 years old, or when anyone has cancer, they say, oh, I cannot eat meat anymore. I have to be vegetarian, right? It's not possible. And those people who are vegetarians or become vegetarian, and then when they go through chemotherapy, it is actually more difficult for them. Those who eat proper proteins and proper nutrition, they can actually improve better. Yeah. And of course, activity, physical activity is very important. Stress management, sleep cannot be stressed enough, all right? That how important is sleep. But the problem is we are all always so busy, 24 hours, that we forget to sleep. Even sleep, we are thinking what we want to do next, okay? And for that, our cells are always on a 24-hour working zone. When are your cells resting? All right? And these are the cause of all the diseases that's coming up. Disease stands for dis-ease of your cells, right? Yeah. Okay. All right. So to summarize, prevention of breast cancer. This is why you're here, to be breast aware. Know about breast self-examination, yearly screening, and advocating the early intervention. Know about it. Be brave about it. We have cancer support groups. All right. And of course, lead a healthy lifestyle like nutrition, dense meals, exercise, sleep, adequate sleep, and reduce stress. So to conclude, breast cancer are diagnosed at much younger age now. So don't think that because I'm young, I don't think I'll get cancer. I'll just, not bother about it. Diagnosis is safe with core needle biopsy. Know about personalized treatment according to your molecular subtypes of breast cancer to improve your survival as well and to offer you better options. Okay, so be breast aware and know that prevention is better than cure. Right? So I have a QR code here and some of the videos I've made with Top Health Asia that you can look into. Top Health Asia is one of the health information platform that you can look and learn more about more information. There's only so much I can cover in 1 hour. I have videos on breast self-examination that you can check. All right, and many others as well. Okay, so with this, thank you very much.